Some people are jumping the gun and sort of talking about what that is before it's completed, and that's creating some confusion. So the first thing I would say is everybody just needs to take a pause. For provinces to say whether or not they're going to participate in something or not when they don't even know what it is a little premature.
That's Health Minister Mark Holland today responding to pushback from some provinces on his upcoming pharmacare legislation. It's set to be tabled by this Friday. And while we know a deal on the bill has been reached between the Liberals and the NDP, all we really know is what the NDP has said about the bill, that it will include a framework for single-payer universal pharmacare and coverage for diabetes medication and birth control. Some provinces, though, have already said if a universal system goes forward, they want to opt out. Here's some of what those provinces have told CTV. Alberta says it does not intend to join the pharmacare plan and is instead demanding per capita funding for their provincial healthcare system. Quebec also says it will demand a, quote, unconstitutional right of withdrawal from the full compensation, And the government of Saskatchewan saying today it needs to see more details of the deal, but it is, quote, not interested in reducing the scope of its existing plan if the new plan will result in reduced benefits. It says any proposed national program has to be designed and implemented in partnership with the provinces and territories. NDP leader Jagmeet Singh was asked this week about some of those opt-out comments by the provinces. Here's what he said.
I'm not surprised that conservative premiers that have cut investments in healthcare, who have hurt people by not investing in healthcare, don't want to help people that are struggling with the cost of diabetes. Not surprising to me. Those are the same premiers. If you look at the healthcare system in their provinces, they've made massive cuts that have hurt workers, that have hurt healthcare workers, and have hurt patients. We've seen horrible situations occur in both provinces because these are premiers that don't want to invest in taking care of people.
Here to talk more about all of this are former federal health ministers Jane Philpott and Ujjal Dosanjh, and former Alberta Health Minister Fred Horne. Hi, everybody. It's so nice to see you. Thanks for making time for the discussion. Dr. Philpott, I'll start with you because you have been pretty vocal over the last number of years and as recently as when the House returned in the fall about your support for universal single-payer system. Are you surprised at all at the nature of the resistance from some provinces right now?
No, I would say the context that we're in right now in terms of some of the relationship that the federal government has with some of the provinces, it doesn't surprise me. It does seem, as the minister said, a little premature given that the legislation hasn't yet even been tabled for these decisions to be made. And these conversations between the feds and the provinces always are challenging. But I wish them very well. It's going to be really interesting to see how this plays out. If provinces are going to ask for reimbursement with opt-out, they will have to provide some kind of a comparable program. And to date, they have programs, but they are not going to be comparable to a single-payer program from what I can see. So there should be some interesting discussions ahead. I hope they go quickly because people are waiting to get the care they need.
Mr. Horne, do you think that it was predictable that some provinces wouldn't want to be a part of this, despite the fact that the legislation has yet to be introduced? And do you understand or sympathize with some of the thoughts that they've put forward so far?
Yeah, well, I think the first thing I'd say is, I agree that it's premature to reject this out of hand with the legislation not having even been tabled yet. But what I will say is that it on the flip side, it is a problem that the provinces apparently don't know more about the details of what's coming. Mm-hmm. And there has been some criticism in the media reported about lack of consultation with the provinces. So I think you could point fingers either way. I'd agree with Jane that the political dynamics being what they are, there are some provinces that are potentially just going to reject this out of a jurisdictional argument, maintaining that healthcare is their responsibility. But and so that may be predictable, but I think you will see, a thoughtful, informed discussion, and there's arguments on both sides of this particular policy approach, the universal single payer approach, that do need to be discussed. And the lens is a lot different when you're overseeing a provincial health system.
Mr. Desange, Mr. Horn brings up an interesting point. I think when we have big changes to healthcare, normally the process is there is a big discussion, a fulsome discussion between the provinces and the federal government. That almost seems as though it will happen after the Liberals had to come to an agreement with the NDP. That's sort of the political imperative that was at play for them. How do you think that informs how this is unfolding?
Well, obviously, I mean, this is being done in haste out of political necessity. When I was the Minister of Health, before Jane was there, we started talking about a national pharmacare. We began to have discussions around, what are the cost drivers? If you have no control over cost drivers, it's simply you're farming out, you're throwing out money at the provinces. So you need to have those discussions, and you need to make sure that you have a national formulary. We don't even have a national formulary. I think that this is premature in the way they're doing it basically out of political necessity rather than sitting down and designing the program with the provinces. And I think Saskatchewan made an interesting point that if you have a national pharmacare program, it shouldn't result in diminishing of the benefits. It should result in increased benefits. And those are questions that are very important. And you can't throw out a national pharmacare plan discussed between two political parties on the national scene without prior consultation with all of the provinces. Some of them are going to opt out. I mean, Quebec always opts out. At least the rest of the country remains together, and then Quebec comes along, follows the standards. I mean, that's the routine in our country.
At the same time, while there hasn't been consultation in this iteration, Dr. Philpott, there have been a number of studies and even a specific task force that examined all the evidence that was there and then came forward with its own proposals. And that's been in the public sphere for a long time. You were around the cabinet table when those kinds of decisions would have been made one way or the other. How would you explain to Canadians the hesitancy prior to now of the federal government for pursuing universal single payer?
Well, that's a great question, and the reality is, I would respectfully argue with Mr. Desange to say I don't think this is premature. We've been talking about this for decades, as he said. It goes back to his time and well before that. So we have been talking about it for a very long time. There was a fantastic task force report that was led by Dr. Eric Hoskins, which I think has been widely supported, and hopefully we're going to see many pieces of the legislation that will align with what Dr. Hoskins and his team suggested. I would agree with Fred that it would have been wonderful if we'd seen a bit of a more opportunity for provinces to be involved in the details of this specific legislation. And, one never knows what's actually happening in the background. We saw on a completely different issue that there's a bit of debate as to whether or not there have been discussions between the provinces and the federal government over policy issues. And those conversations are not always made public. So perhaps there has been more conversation than we're aware of. It's always better if people can come to a consensus. But Canadians have come to a consensus that they need access to medication. The women who are going to get access to birth control in these provinces will want to know that they have fair access, that they have single payer access, that they can walk in without having to wonder whether they're going to be able to afford their medication. And I think the people from those provinces where they are looking at potentially not participating, there are going to be people with diabetes and people who need access to reproductive care that will certainly be hoping their provinces will fully participate.
Mr. Horn, with the strong caveat that we don't know the details of what exactly is in the legislation, if you were still a provincial health minister, what would be the primary worry you would have about a universal single payer system?
I think as provincial ministers, you've always got to be concerned about the opportunity cost of your decisions. And so what I would be looking for is, what are the consequences for private payers? The companies that sponsor and underwrite employer-sponsored benefit programs, for an example, which make up a large part of how Canadians access prescription coverage. That's not to say that, affordability of co-payments and premiums, something the federal government has talked a lot about, is not a concern. But beginning, and something that was quite surprising about this is that the fact that drugs, an initial set of drugs are being covered, which was not part of the original agreement between the NDP and Liberals. The agreement was to table framework legislation. So we now have a situation where someone, I'm sure on the basis of a very good thought, has chosen, quote, winners in terms of drug categories as initial drugs to be funded. And you've got to be concerned about what happens when governments assume the first payer role, really for any medication, because it can have consequences for then what private plans determine that they're going to cover. If it was up to me, just very quickly, my ask in pharmaceutical policy would have been for the federal government to take on a suite of drugs, which are called drugs for rare diseases. Affects about 3 million Canadians. These drugs tend to be higher cost. We don't always have all of the data in yet to support their ongoing sort of permanent listing. That's an area of real need where the federal government made a commitment a year ago to $1.5 billion, and the lion's share of that to support funding those drugs and making them available to Canadians, which is something that's very difficult for provincial governments to do. So lots of unanswered questions here about what some of those consequences might be at the provincial level.
Mr. Desange, last word to you. When the legislation is tabled, what will you be watching for specifically?
Well, you'll be watching how the funds flow and how the plan is put together. We don't know. I mean, ultimately, the cost drivers are in the hands of the provinces. And that's why I think that it would have been comforting if one knew that there had been discussions publicly between the provinces and the federal government. And right now we are in somewhat of a sort of a dark situation of darkness, and it's very difficult to understand what's going on. Except we try and predict what might come out, might not come out. I mean, Mr. Horn has raised some very complex questions. I mean, how does this fit in with extended healthcare benefits, and who pays and who benefits, who doesn't pay? These are very important questions, and the public at this moment knows none of the answers. And it's quite, federal government obviously can't impose an obligation on the provinces to do something in healthcare because it's provincial jurisdiction. But ultimately, consultation is required, and it would have been more comforting to know that there had been some consultation before this was put forth out of what seems to be a political necessity at the last minute before an election.
Well, we'll look into the details when it is tabled, and hopefully we can reconvene then. I appreciate all of you making time for the discussion this evening. Thank you, Dr. Philpott, Dr. Jane Philpott, Fred Horn, and Ujjal Desange.